The drug stockout can visibly be seen at the hospital pharmacy where the whole stall is almost empty, a clear indication that the hospital lacks life-saving drugs. Dr. Chandi Fred Opeli, the medical superintendent Moyo General Hospital, said the hospital has not received drugs from national medical stores for the past 3 cycles, which is over 200 million shillings, saying the last time national medical stores brought supplies in the hospital was in March this year, but what they supplied were other assorted items which were also in small quantities. But they made a promise to supply the hospital with drugs, but up to date they have not supplied.
It's now more than 4 months that we received our last supplies of medicines and supplies from NMS. The last time we received was in March, and it was Circle 3 and 4 for last financial year. We expected the deliveries for Circle 5 and 6 in May. It never came. In June, it never came. July, they told us it would come. It never came.
He, however, appealed to national medical stores to consider supplying the hospital with the medicines they have not been supplying for the past cycles, and they need to improve and follow their timetables for supplying drugs, saying they have a very good schedule for supplying drugs, but in most cases they don't follow their schedule, and this doesn't go well with the public.
NMS, my appeal is they should take into consideration the medicines that have not yet been supplied. There's more than for last year, and part of the other year is it has gone to more than 225 millions. We need those medicines and supplies, and also they need to regularize these deliveries. They give us a very good schedule. If I show you the schedule, it's a very good schedule, and we are comfortable for the deliveries for the different circles. But it's very rare that they really follow those schedules.
Mr. Mawa Basir, the chairperson board of directors Moyo General Hospital, said he is aware national medical stores might be having challenges in making supplies to the hospital, but urged the leadership of the national medical stores to try and at least make some supplies, even if not all, so that the health workers can move with their heads up and the public seeking health services at the facility can be able to receive treatment at the facility.
I would really say the NMS authority should look into these issues. I know they will also equally be facing challenges, as the MS said, but to a bigger margin, they should try to minimize. At least something should be done to help the health officers here talk with the heads up. In the absence of that, any failure to do that results into serious consequences.
Mrs. Onger Tojeska, the Chief Administrative Officer Moyo, acknowledged that at least for the past 3 cycles, the hospital had not received drugs from national medical stores, saying there might be challenges facing national medical stores, but urged them to act swiftly and supply the hospital with drugs, adding that failure to supply the drugs will affect service delivery to the public, yet the money has been paid.
But of course, you know, when the drugs are not there, our people even don't seek care. But also, really, the ones that could have come and be treated are also really, their health deteriorates even more. So my appeal is, I really understand their challenges, but at least not 3 circles. They can try to do better. And even where they have chosen to bring, let them bring the real quantities. Because it is useless for us to have a budget that is not really provided. For me, I think it beats the whole purpose of really serving the people and bringing the services to the people when we cannot give them the services.
The National Medical Stores NMS has been mandated by the Ministry of Health to store and supply medical equipment and drugs to all the government hospitals and health centers. However, Moyo General Hospital has not received the medical drugs for the past 3 cycles, which has resulted into drug stock out in the hospital. It's from this background that the district leadership, together with the hospital authorities, are requesting national medical stores to act fast on the matter so as to save the lives of the public. Dominic Anthony Okumu, West Nile TV, Nilecast.